How is bone mineral density, BMD, measured? Imagine trying to understand how strong your bones are without breaking them open. That's where bone mineral density testing comes in. The most common and trusted way to measure BMD is through a procedure called dual energy X-ray absorptiometry, or DXA. This test uses very low doses of X-ray energy to look at specific parts of your bones, usually the spine and hips, which are key areas for fractures related to osteoporosis. During the test, you lie comfortably on a soft table while a scanner moves over your body parts being examined. The scanner captures images that show how much calcium and other minerals are stored in your bones, giving a clear picture of their density. Because it's quick, painless, and involves very little radiation, DXA is considered the gold standard for diagnosing osteoporosis and evaluating fracture risk. There are two main types of DXA scans. The first is called central DXA, which measures bone density at the hip and spine. This type provides the most accurate information for diagnosing osteoporosis and predicting fracture risk. The second is peripheral DXA, or PDXA, which measures bones in the wrist, fingers, leg, or heel. These smaller machines are often used in clinics or health fairs and are mainly for screening purposes rather than definitive diagnosis. Besides DXA, other methods exist but are less commonly used. Quantitative computed tomography, or QCT, is a three-dimensional imaging technique that can separately measure the outer hard layer of bone and the inner spongy part. It involves higher radiation exposure and costs more, so it's usually reserved for specific cases. Quantitative ultrasound, or QS, uses sound waves instead of radiation to estimate bone quality at places like the heel. While portable and safe, it cannot definitively diagnose osteoporosis or track treatment progress. A newer technique called radiofrequency echographic multispectrometry, or REMS, is portable and radiation-free. It measures bone density at the hip and spine and offers an alternative to DXA. Preparing for a BMD test is simple. You should avoid calcium supplements for about 24 hours before the scan and remove any metal objects such as jewelry or belts that could interfere with the images. If you are pregnant, it's important to inform your healthcare provider because X-ray procedures are involved. After the test, your results are usually reported as a T-score, which compares your bone density to that of a healthy young adult. A T-score of -1 or higher is normal. Between -1 and -2.5 indicates low bone density, called osteopenia. A score of -2.5 or lower suggests osteoporosis, which means a higher risk of fractures. As your score decreases, so does your bone strength and stability. In summary, measuring bone mineral density is a crucial step in understanding your bone health. The most reliable method is the DXA scan of the hip and spine, providing essential information for diagnosis and treatment planning. Other techniques can help with screening or offer additional insights but are generally supplementary. Accurate BMD measurement helps healthcare providers assess your risk of fractures and monitor how well treatments are working. Always consult with a healthcare professional to interpret your results and develop a plan tailored to your individual needs.